Welcome back to the deep dive. It is great to have you with us. Today, we are going to start with a little bit of a mental exercise. I want you to close your eyes for a second, unless you are driving or operating heavy machinery or juggling. Please keep them open in that case. But for everyone else, just close your eyes for a moment. When I say the word healthcare, what's the very first image that pops into your head? Don't overthink it. Just the first flash.
It's almost always a building, isn't it?
It is. It's a building. For me, it's a sterile hospital room with those, those distinctively uncomfortable vinyl chairs and that smell of antiseptic. Or maybe it's a doctor's office with the crinkly paper on the exam table that makes a noise every single time you shift your weight.
Yeah. Or a pharmacy counter.
Yeah.
The fluorescent lights buzzing overhead and the little white bags stapled shut.
Exactly. We've been conditioned collectively to think of healthcare as an event that takes place inside four walls.
We think of it as a destination, a fortress, really. A place you go to get fixed.
A place you go to get fixed. That's a great way to put it. But what if that assumption is, well, not wrong, but incomplete in a really dangerous way?
Okay.
What if the single biggest factor in whether you actually recover from an illness, whether you manage a chronic condition or you end up relapsing, what if it has absolutely nothing to do with the pill you swallow or the surgery you undergo?
So you're saying it's not the clinical part?
Not entirely.
Yeah.
What if the most critical moment in your healthcare journey actually happens on the road in transit?
That is the provocative question we are tackling today. We're looking at a source titled The Vital Link, How NEMT Drives Patient Success from the SwiftAid Transport blog.
NEMT, let's define that right away.
Right, it stands for non-emergency medical transportation. And vital really is the operative word here.
No, I can hear the listeners right now. I can almost feel the skepticism coming through the microphone. They're thinking, okay, you guys are doing a deep dive on van schedules, on logistics. How is this going to keep me hooked for an hour?
And, that's a fair reaction on the surface. We're so used to thinking of transportation as a utility, like electricity or water.
You just expect it to be there.
You do. But the mission of this specific deep dive is to completely reframe that reaction. We are not looking at NEMT as a ride service. We're not talking about Uber for doctors. We're looking at transportation as a critical piece of medical infrastructure.
A piece of infrastructure.
Yes. We're arguing, based on this source, that this infrastructure saves lives, it saves massive amounts of money, and honestly, it saves the sanity of patients and their families.
It's a huge shift in perspective then. The source is forcing us to stop viewing transportation as a convenience like, ordering a pizza or catching a cab to the airport, and start viewing it as a medical intervention.
A medical intervention. That is a heavy term. Usually when we say intervention, we mean a pharmaceutical or a surgical procedure or maybe a strict physical therapy regimen.
Right. So how does a Ford Transit van qualify as a medical intervention? That seems like a bit of a stretch on the surface.
Well, let's break down the dependency of outcomes. Clinical decisions, no matter how brilliant they are, they don't strictly shape outcomes on their own.
Okay.
You can have the most brilliant surgeon in the world, someone who has trained for 30 years and has incredibly steady hands. You can have a medication regimen that's perfectly tailored to your genetic markers and your specific pathology. But if the patient cannot physically get to the location to receive that treatment,
It doesn't matter.
it's completely irrelevant.
Yeah.
Even more critically, if they can't get to the follow-up appointment to ensure the treatment is actually working, the clinical excellence is moot.
It's the tree falls in the forest scenario of modern medicine, isn't it?
Yeah.
If the best doctor in the world prescribes a cure, but you're stuck in your living room across town with no way to get there, did the cure even exist for you?
Precisely. It effectively didn't. And this introduces the core concept of today's discussion: care continuity.
Care continuity.
We are moving past the idea of NEMT as just a ride. We're looking at it as the glue or maybe the connective tissue that holds the entire healthcare plan together. Without it, the plan just disintegrates. It doesn't matter how good the plan is on paper if it can't be executed in reality.
Okay, let's unpack this idea of invisible infrastructure. The source calls transportation an overlooked contributor to patient outcomes. Why is it overlooked? It seems so intuitively obvious that you need to get to the doctor to see the doctor. Why do we, as a system, tend to miss this?
It is obvious, but it's often invisible to the healthcare system itself because of how that system is designed.
How so?
The healthcare system is designed around the facility. It's that fortress model we mentioned. Once you are inside the fortress, the hospital, the clinic, Everything is tracked, monitored, and optimized.
Sure, your heart rate is on a central screen, your lab results are in a digital database, the temperature of the room is controlled.
Exactly.
Yeah.
Everything is under control. But the moment you step out those automatic sliding doors, you enter a blind spot for the system.
You fall off the radar. The data stream just stops cold.
Completely. The healthcare system effectively loses sight of you until you walk back in. But your life and, crucially, your recovery happens in that blind spot.
And that's where everything can go wrong.
That's where it all happens. The source highlights a trio of success factors that rely entirely on what happens in that blind spot: access, follow-through, and continuity of care. These are the pillars of recovery.
And the argument is that transportation is the foundation for all three of those pillars. So if that foundation cracks, the pillars fall, and the patient ends up, well, creating a crater in the system.
Correct. The source explicitly states that medical care does not stop at the facility door. That's the huge misconception we need to dismantle.
We tend to think, okay, the surgery is done, the patient is discharged, the care is over.
Right. But for chronic conditions, for rehabilitation, for complex recoveries, the surgery was just the starting gun. The race is the recovery. And that race happens at home and in the transit back and forth to the providers who are managing it.
So when transportation fails, the clinical care is essentially undermined. It's like building a beautiful multi-million-dollar bridge, but then completely forgetting to build the on-ramp.
Undermine is the perfect word. A treatment plan is only as good as the patient's ability to physically show up for it. The source creates this image of an invisible infrastructure. We see the expensive MRI machines, right? We see the flashing lights of the ambulances.
Of course, the high-tech, dramatic stuff.
But we don't see the NEMT vehicle that ensures the patient gets to the appointment where the doctor realizes the medication needs adjusting. If that ride doesn't happen, the adjustment doesn't happen, and the patient deteriorates at home. It is the invisible thread that stitches the disparate parts of the healthcare system together.
This connects directly to a concept we hear about a lot in public health circles. It's a bit of a buzzword, but I want to make sure we really understand it in this context. Social determinants of health, or SDOH.
Right. This is crucial context. If you want to understand modern healthcare, you absolutely have to understand SDOH.
Just define it for us. What are we talking about?
Social determinants of health are the conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. It's everything outside the clinic walls.
I've heard it described as the idea that your zip code is a better predictor of your health than your genetic code.
That is often scarily true. And transportation is widely recognized as one of the major determinants. We often talk about food deserts, places where you can't buy fresh produce.
Sure, that's a common term now.
But we rarely talk about transportation deserts or the transportation gap. If you live in a transportation desert, your health outcomes are statistically likely to be worse than someone who lives right next to a transit hub, all other things being equal.
The source gets very specific here about who is most at risk. We aren't just talking about everyone, we are talking about specific populations, right?
Exactly. The source details three main groups: seniors, individuals with disabilities, and patients with chronic conditions.
And these are the populations who use the healthcare system the most.
They do. And to understand why NEMT is so vital, we have to really empathize with their reality for a moment. Let's paint a quick picture here.
Okay.
For a healthy 20-something with a car, a doctor's appointment is a scheduling annoyance. You have to take an hour off work, maybe fight some traffic, pay for parking. It's a nuisance. You might complain about it at dinner.
Right, it's a calendar conflict. It's annoying, but it's solvable. It's a low-level problem.
Exactly. But now let's consider a senior who can no longer drive, maybe due to macular degeneration or slowed reaction times. Or think about someone with a disability that requires a wheelchair-accessible vehicle. For them, the lack of a ride isn't an inconvenience, it's a wall. It is a physical barrier preventing them from accessing the entire system.
A wall is a good way to put it. It's binary. You either get over the wall or you don't. There's no middle ground.
Imagine an elderly woman, let's call her Mrs. Miller. She has congestive heart failure. This is an incredibly common condition. She needs to see her cardiologist every month to check her fluid retention and tweak her diuretics.
Standard procedure for that condition.
Right. But she doesn't drive anymore. Her daughter loves her, but lives 3 hours away and works full-time. So if there is no NEMT service, or if the service is unreliable, Mrs. Miller simply cannot go. It's not that she chooses not to go. She cannot go.
The source puts it very bluntly. For these groups, transportation access determines whether care is received at all. It's not about being late. It's about a complete absence of care.
And that absence leads to what we call the transportation gap. The source lists the consequences of falling into this gap, and they are really severe. It's not just, oh, I missed a checkup.
What are they specifically?
It means missing crucial follow-ups after a procedure. It means delaying preventive care, like a mammogram or a colonoscopy, until it's too late.
So small problems become big problems.
Exactly. It means interrupting treatment plans. Think about chemotherapy or dialysis. You can't just miss one without serious consequences. And eventually it means relying on emergency services.
That last one is the kicker for me. If you can't get to your regular doctor because you don't have a ride, you don't just stop being sick. You wait until you're sick. You have to call an ambulance.
Which is the most expensive and least efficient way possible to receive care. You're using a $10,000 emergency response for a problem that could have been solved with a $100 office visit.
It's a total system failure.
It is. And reliable NEMT is the mechanism that closes this gap. It ensures safety and consistency. It changes the entire dynamic from reactive waiting until Mrs. Miller can't breathe and calling 911 to proactive, getting Mrs. Miller to the cardiologist on Tuesday so she stays stable. It transforms the nature of the care itself, from crisis management to maintenance.
Let's talk about the specific mechanics of this failure. The source brings up a term, appointment adherence. Now, to me, adherence sounds like something a school teacher would say, adhere to the rules. But in medicine, it's life or death. Why is missing one single visit such a big deal?
It's the domino effect. It starts small and it gets catastrophic very, very quickly. The source unpacks the downstream effects of missed appointments, and it really is a chain reaction.
So what's the first domino to fall?
First, there's inefficiency from the provider's side. Wasted provider time.
That's the business side of it, the operational cost.
It is, but it matters to everyone. If a specialist, a neurologist, an oncologist has a 45-minute slot blocked off for a complex patient, and that patient is a no-show, that is a resource that is lost forever. It can't be recovered.
And someone else could have used that slot.
And someone else on the waiting list, who might be waiting weeks or months, could have had that appointment. So it clogs the entire system. It creates a backlog that affects the whole community.
Okay, but from the patient side, what's the domino effect for the person who missed the appointment?
From the patient side, it means delays in diagnosis. If you miss the appointment where the doctor was going to check a lump or review a worrisome blood test, the condition worsens in the background. It isn't paused just because you aren't in the office.
It's progressing silently.
It's progressing. It also means interruptions in treatment momentum. Think about something like physical therapy.
Right. If you're rehabbing a knee replacement and you miss 2 weeks because your nephew couldn't give you a ride.
Your recovery doesn't just pause. It often regresses.
Yeah.
You lose range of motion. The scar tissue starts to harden. You lose strength. Now you need more therapy than you would have originally, and the final outcome might not be as good.
So you've lost ground.
You've lost significant ground. And then there's the cost. This is the biggest domino. Conditions get exponentially more expensive when they're ignored. A minor skin infection treated at a clinic is cheap, maybe $100 for the visit and the antibiotics. Sepsis treated in the ICU is astronomical. We're talking tens of thousands of dollars per day.
So how does NEMT specifically fix this? The source mentioned something I found really interesting, removing the will my ride show up anxiety.
That anxiety is a massive and underestimated barrier to care. Even if someone have a plan, if that plan is fragile, it causes immense stress.
What do you mean by a fragile plan?
If you're relying on what the source calls informal networks, neighbors, family members, community volunteers, there's always a variable. Will my neighbor's car start this morning? Will my daughter get stuck in a meeting at work? Is it raining too hard for my elderly friend to drive safely?
And there's the dignity aspect of always having to ask for a favor, too. You don't want to feel like a burden. I know I hate asking people for a ride to the airport, let alone to a dialysis appointment 3 times a week.
Exactly. That is a huge psychological factor. People will think, I don't want to ask Susan again. She took me last week. So what do? They cancel the appointment. They choose their sense of pride over their physical health.
Which is a terrible choice to have to make.
It's an impossible choice. Professional NEMT removes the favor aspect completely. It's a service. It's transactional in a good way. It provides scheduled, dependable pickups. And critically, it supports mobility limitations.
That's a key point. It's not just a car.
Right. It's not just a car. It's support. If you need a wheelchair lift, or if you can't step up into an SUV, a neighbor's Toyota Camry won't help you. Professional NEMT ensures that the vehicle matches the physical needs of the patient. It's the right tool for the job.
The key takeaway here seems to be that when patients arrive prepared and on time, the healthcare system, it actually functions as intended. It's like putting oil in an engine. Without it, the gears just grind to a halt.
That is a great analogy. The healthcare system is a high-performance engine. It is designed to treat people who are present. It has very, very few tools to help people who are absent. NEMT brings the person the fuel to the engine.
Now, I want to move to a specific moment the source highlights as one of the most critical points in a patient's journey, the post-discharge period. You've just been released from the hospital. Why is this particular transition so dangerous?
The transition from hospital to home is notoriously fraught with risk. It's a point of maximum vulnerability.
Why, though? It seems like going home should be the safe part.
Think about the physiological and psychological state of a patient at discharge. They've just been through a significant medical event, a surgery, a severe illness, a stroke. They are likely medicated, perhaps in pain, certainly fatigued and disoriented.
And they're leaving a very controlled environment.
An incredibly controlled environment where nurses checked on them every hour, where meals appeared on a tray, where medications were delivered on a schedule, and they're entering a completely uncontrolled environment, their home.
And suddenly, they are in charge of their own recovery. They go from having a full team to being solo.
Correct. And the source emphasizes that without reliable transportation at this specific juncture, the risks of failure just skyrocket. The first risk is simply returning home unsafe.
Right. If you're groggy from anesthesia or pain meds, you absolutely cannot drive. And taking a bus might be physically impossible or dangerous. You could fall. You could get lost. You could be exposed to germs while your immune system is compromised.
Precisely. But there's a detail in the source that I found fascinating, and it's something people often forget: the medication gap.
Oh, catch that for us. What is the medication gap?
Often, when you are discharged, you are given new prescriptions. Vital ones. Pain management, antibiotics to prevent infection at the surgical site, blood thinners to prevent dangerous clots.
The things that are supposed to keep you from coming right back to the hospital.
Exactly. But if the transportation just drops you at your front door, and you haven't stopped at the pharmacy, and you have no way to get to the pharmacy later, you have a gap. You are home, but you are not medicated.
That is a recipe for disaster. You're home, the hospital-administered pain meds wear off, the real pain sets in, or an infection starts to flare up, and you have no way to fix it because you're stuck on the couch.
Exactly. And by the time you figure out how to get the meds, maybe calling a relative who can't come until tomorrow morning, it might be too late.
Yeah.
The infection has already taken hold. The blood clot has started to form. Professional NMT services often account for this. A good NMT provider knows the protocol: hospital by shelf pharmacy, home. That extra stop isn't a courtesy, it's a clinical necessity. It bridges the medication gap before it even opens.
The source also notes something called therapy lag.
Right, another critical window. If you're supposed to start outpatient rehabilitation within 48 hours, which is common for joint replacements or stroke recovery, but you can't get a ride, that window closes. The clinical outcomes drop significantly if you miss that early mobilization window.
And then there is the confusion factor. The source notes that poor transport increases stress and confusion for patients and caregivers. I can just imagine that. You're standing at the hospital curb, holding your little plastic bag of belongings, looking for a ride you're not sure is coming. It's chaotic.
It is. You're trying to remember all the discharge instructions, a flood of information, while also worrying about whether your ride is going to show up. It's a state of sensory overload at a time of extreme vulnerability.
It's the last thing you need.
It really is. Professional NEMT acts as a stabilizer here. It facilitates the safe return home, sure, but it also ensures that the very first follow-up happens. The expert NEMT provider isn't just a driver. They are reducing confusion during a chaotic time. They know where the preferred pharmacy is. They understand the discharge protocol. They provide a continuous chain of custody, in a sense, from the hospital bed to the living room chair.
And if that chain breaks, we end up discussing the next section of our deep dive, the revolving door, or as the industry calls it, readmissions.
This is a huge topic in healthcare economics and quality standards. Readmissions. Hospitals obsess over this metric. If you work in hospital administration, readmission rates are probably haunting your dreams.
Connect the dots for me then. How does a simple van ride relate directly to hospital readmission rates?
The logic is straightforward, but incredibly powerful. Readmissions are costly, they're stressful, and they often signal a failure in the care plan. And a common cause, as cited by the source, is lack of access to follow-up care.
So it's not that the surgery failed, it's that the patient couldn't get back to the doctor to check on the incision.
Exactly. Or they couldn't get to the lab to check their blood levels after being put on a new medication. The source frames NEMT as a preventative measure here. It enables early intervention.
Can you give us a concrete example of how that works in practice?
Sure. Let's go back to our post-surgical patient. Let's say they have an incision from an appendectomy. If they can get to their follow-up appointment 3 days after discharge, the doctor might look at it and say, hey, this looks a little red. Let's treat it with a topical antibiotic and keep an eye on it. Problem solved. $10.
Okay. But if they miss that ride,
They stay home. They hope it gets better on its own. The redness turns into a full-blown infection. The infection goes systemic. 3 days later, they're spiking a high fever, they're delirious, and they're back in the emergency department. That is a readmission. And it was entirely preventable with a $50 ride.
it's the difference between proactive and reactive care, plain and simple.
It is. Proactive care uses a small, targeted resource, the ride, to prevent a huge, expensive resource, the hospital bed, from being used unnecessarily.
It just seems so logical.
It is. NEMT strengthens the link between discharge planning and successful recovery. It stops that awful cycle of treat, release, relapse, repeat. That cycle is demoralizing for the patient, and it's completely draining for the system. It burns out staff, and it bankrupts patients.
It's interesting you mentioned demoralizing because that leads us perfectly to the human side of this. We've been talking a lot about logistics and costs, but the source has a whole section on patient experience and trust.
This is the psychological impact of logistics. We often divorce the business of healthcare from the feeling of healthcare, but for the patient, they are one and the same experience.
How does the ride affect how a patient feels about their doctor? It seems like two different things. If I take a taxi to a restaurant and the taxi is dirty, I don't blame the chef for my food.
That's true for a restaurant, but healthcare is different. It's an inherently vulnerable experience. The source introduces this concept of the touch point. Transportation is often the very first interaction a patient has with the healthcare system on the day of an appointment, and it's the very last interaction they have when they leave. It bookends the entire experience.
So it sets the tone at the beginning and leaves the final impression at the end.
Precisely. Imagine this scenario. You are anxious about a medical test, maybe it's a biopsy, and you're worried about the results. You're already scared. The van is 30 minutes late. You're waiting on the curb in the cold. The driver finally arrives and is grumpy. Maybe they're smoking a cigarette. Maybe they're driving aggressively. The vehicle itself is dirty. By the time you get to the doctor's office, what is your state of mind?
I'm stressed out, I'm angry, my cortisol is spiked, and my blood pressure is probably through the roof before I even see the nurse.
And you are likely less trusting of the entire system that you're about to interact with. You're thinking, they can't even get me here on time. How can I trust them to do this delicate procedure correctly? The source explicitly states that poor transport experiences undermine confidence. If the logistics fail, the patient assumes the medicine will fail too.
Conversely, a good ride could have the opposite effect.
A great ride reduces anxiety. It provides a greater sense of dignity and respect. The source uses those words specifically: dignity and respect. For a patient who has lost some of their independence, maybe they are in a wheelchair now, maybe they're just frail, being treated with care and professionalism during transport restores a sense of control and self-worth.
It's about building trust from the first moment. If the system cares enough to pick you up safely and on time in a clean vehicle with a professional driver, you trust that same system with your health.
Yes, it leads to increased trust in the healthcare provider. It seems distinct, but in the patient's mind, it is all one seamless experience. The ride is part of the care. If the driver is kind, professional, helps them lock their front door, helps them safely into the lobby, they walk into that appointment feeling supported and calm.
And that mindset matters for healing.
It absolutely matters for healing. We know from countless studies that high stress impedes healing. So a good NEMT service is actually contributing to the physiological environment for recovery.
Yeah.
It's not just a nice to have.
Now let's flip the perspective for a minute. We've talked a lot about the patient, but the source mentions another group that benefits hugely from reliable NEMT, the care teams themselves.
This is the workforce perspective.
Yeah.
It's so important. We're talking about discharge planners, social workers, care coordinators. These are the unsung heroes of the hospital. These are the people whose entire job it is to make sure patients are safe when they leave the fortress.
I have a friend who is a social worker in a hospital, and she says half her day is just putting out fires.
And often, those fires are transportation fires. Mrs. Jones is ready for discharge, but her son's car broke down. Mr. Smith missed his dialysis transport, and now we have to figure something else out. The source discusses how reliable NEMT completely changes the workday for these professionals. It reduces last-minute transportation issues. It creates predictable discharge timelines.
Why is predictability so important for them and for the hospital as a whole?
Because a hospital is a flow system. It relies on throughput. Think of it like a hotel that is always 100% booked. If a patient is medically cleared to leave at 2 p.m., that makes their bed available for a new patient coming up from the ER who desperately needs it.
Okay.
But if the ride for the discharge patient doesn't show up until 6 p.m., that bed is blocked for 4 hours.
The bed blocking problem, I've heard of that.
Exactly, and it causes a cascade of failures. The whole system backs up. The emergency department gets overcrowded because they can't move patients upstairs. Surgeries might get postponed. It affects everyone. And the social worker is the one stuck in the middle of it all.
Stuck on the phone, listening to hold music, trying to find a driver, while also juggling 10 other patient crises.
Exactly. That is time spent troubleshooting logistics. The source argues that when the ride is guaranteed, when they have a reliable NEMT partner, the social worker can actually do their real job. They can focus on clinical and social support rather than crisis management.
They stop being a travel agent and get to be a social worker again.
Yes, they can have a meaningful conversation with the patient about their home life, their fears about recovery, their medication compliance. They can do the work that prevents readmissions instead of just managing the logistics of the current admission.
So reliable NEMT essentially gifts time back to the healthcare providers.
And that time is one of the most valuable resources in the entire system. It improves the quality of care across the board. It's an operational efficiency that pays massive dividends in patient outcomes. A stressed-out, overwhelmed social worker is less effective. A supported social worker saves lives.
We're reaching the final section of the source material now, and it zooms out to the biggest picture. The industry term is value-based care.
This is the major shift happening in American healthcare right now. It is the essential context for everything we have just discussed.
Break it down for us. What does value-based care actually mean in simple terms?
Historically, for decades, healthcare operated on a fee-for-service model. You do a test, you get paid. You do a surgery, you get paid. You admit patient, you get paid.
It incentivized doing more things.
Volume.
It incentivized volume. It didn't really matter if the patient got better, financially speaking, as long as the service was performed and billed for correctly.
Okay, so how is value-based care different?
Value-based healthcare flips their entire model on its head. It pays for outcomes. It pays for value. You get paid for keeping the patient healthy. You get paid for preventing the readmission.
So, under this new model, a hospital might actually lose money if the patient comes back sick within a certain time frame. In many cases, yes. They face significant financial penalties for high readmission rates for certain conditions. Or, conversely, they might get a bonus, a share of the savings, for keeping a population of patients healthy at home. This is where NEMT fits directly into the high-level strategy.
How so?
The source says transportation is no longer peripheral. It's not an ancillary service anymore. It is a core part of the value equation.
Because if the goal is improving outcomes, and reliable NMT is proven to drive better outcomes,
Then NEMT is an investment, not a cost. It aligns perfectly with the three main goals of value-based care: preventive care support, reduced avoidable utilization, which is a fancy way of saying keeping people out of the ER and patient engagement.
it's a complete 180-degree turn from thinking of it as a taxi service. A taxi service is an expense line on a budget. In this model, NEMT is a strategic tool.
Completely. In a value-based world, a $50 ride that prevents a $20,000 hospital stay is the smartest money you can possibly spend. It is high-yield healthcare. It's arguably the best ROI in the building, and it doesn't even happen in the building.
So, what does this all mean for us, the listeners? As we wrap up this deep dive, we started this conversation thinking about a van driving down the street.
And we ended up discussing health equity, hospital economics, patient dignity, and the very structure of how we deliver and pay for care in this country.
The source's core message sums it up perfectly for me. When transportation works, healthcare works better.
It's a simple sentence, but hopefully after this hour, we all understand the profound depth of it. Healthcare systems are finally, slowly recognizing transportation as an extension of care. It's not an add-on, it's not a perk, it is a vital organ of the system.
It's that final provocative thought I want to leave everyone with today, that the next time you think about access to healthcare, Don't just think about your insurance card or where the hospital is located on a map.
Hmm.
Think about the physical link. Think about the road, the vehicle, the driver, the real-world connection that bridges the gap between the patient and the cure.
Because without that link, the most advanced cure in the world might as well not exist.
If you can't get there, you can't get better. Thanks for diving in with us today.
It was a real pleasure.
We'll see you on the next deep dive.